The United States is inching closer to a staggering milestone, 1 million deaths, as the pandemic rages into a third year. Hello, I'm Arnold Naidu, and this is The Heat. The number of U.S. deaths from COVID-19 is now about 925,000, but there is some positive news. Cases and hospitalizations across the country have dropped significantly in the last month, and many states are shifting away from mask mandates. California is the latest, but there is a catch. CGTN's Ediz Tiyansan has details.
Considered one of the strictest U.S. states when it comes to COVID-19 restrictions, California is set to lift its indoor mask mandate for vaccinated people. The move comes after a drop in infection rates and hospitalizations. Many who work in close contact with crowds are not willing to let their guard down.
I will be wearing my mask. That's what I will tell you. I will be wearing my mask. I think people are definitely getting tired of the whole thing, but I think again just the number one thing is keeping the community safe.
California is also lifting negative test requirements to visit hospitals and nursing homes, but certain counties will continue to implement their own mask rules.
We're taking a different course in Santa Clara County in that we are continuing to follow our data and metrics to tell us when it's appropriate to lift.
California has had one of the longest mask mandates in effect. Some business owners believe lifting it could help increase sales. The move follows the Omicron coronavirus surge rapidly receding, and it's seen as a sign of the nation's largest economy gradually going back to normal again. Some experts say ending the mask mandate could revive local economies in certain areas. The move comes at a time when California has also announced a blueprint for economic recovery.
The $6.1 billion in tax relief and or grants, and the work to advance our paid sick leave with a retroactivity clause that goes back to January to keep employees, keep patrons, keep employers safe and healthy and businesses open.
Most Californians may now do away with masks, but they will still be mandatory in high-risk areas like public transit and nursing homes, as well as schools, as the low vaccination rate among children still remains a public health concern. Ediz Tiyansan, CGTN, Los Angeles.
Lots to talk about. To discuss this and more, let's bring in our panel. Joining us from Los Angeles is Dr. Gary Richwald. He's an infectious disease expert and the Chief Medical Officer at Real Health. Here in Washington, D.C., Joseph Williams is a journalist and commentator. Eric Miller is the president of Rideau Potomac Strategy Group, a consultancy firm. And from Phoenix, Arizona, Will Humble. He is the executive director of the Arizona Public Health Association. Welcome to all of you to the show. And Will Humble, let me start with a report that was issued by the Government Accountability Office. That's a United States agency that keeps an eye on what other parts of the government are doing, how well they're doing, or in this case, how badly they're doing. This is a very scathing report, and it details shortcomings on the part of the Department of Health and Human Services. And if you look at the report, I mean, one gets the sense that much of the situation that we see the country in right now could have been avoided. What do you make of the report?
Well, yeah, I did read the report, and there was a lot in there. There was a lot to digest. There was more than 100 recommendations for the Department of Health and Human Services. I think the intent of the report, when you read the whole thing, is to provide some information to the federal government to help repair some of the broken parts of the system in the U.S. And some of the major points that they make are often things that you see happening within the federal government here in the U.S., which is a lack of interagency coordination. So the lack of a concrete plan to outline the roles and responsibilities for the Federal Emergency Management Agency versus Health and Human Services, and then the various agencies within the Department of Health and Human Services. They found fault also with the communication system and believe that it needs to be professionalized, and they provided a number of recommendations there. So I think it's less of a this is the reason why the U.S. did so poorly report than it is trying to point out things that could be improved moving forward.
All right, so the criticism, Will, is very constructive. But looking at the last, well, as I said, we're going into the third year now of the pandemic. Are you surprised that this pandemic has lasted so long?
Well, yes and no. I mean, the big wild card here was that we didn't know that we would have this many variants, and that the variants over time would begin to escape the immunity from antibodies, at least, although they haven't really escaped T-cell immunity, but antibody immunity from the vaccines, which were designed against the ancestral strain. And so in that respect, the virus was in control. The other part of it doesn't surprise me at all, because the very nature of our republic here in the U.S. is that it's a decentralized system of decision making. And so you just had a report from California, which was among the best performing states in the U.S. And that's because they had a governor who used evidence and data to drive his decision making. I live in a state, Arizona, where our governor did not do that, and in fact tried to stop local jurisdictions, cities and counties from putting in mask mandates. And there was never a statewide face covering mandate in our state. And as a result, Arizona has the second worst death rate from COVID-19 in the entire U.S., right behind Mississippi. So you see this incredible range of well-performing states like Vermont and California juxtaposed with terribly performing states like Arizona, Mississippi, Alabama, Louisiana. And so it's an artifact of the way decisions are made in the U.S. and who actually has the authority to make decisions and how that decision-making authority is decentralized.
Gary Richwald, the report that we've been talking about, it said, among other things, that Health and Human Services failed to establish clear roles and responsibilities for other partners involved in pandemic responses. So, I mean, there's a whole group that's involved in the response to the pandemic. It's very complex, it's not easy, and to Will Humble's point, much of the report is about recommendations and how to make the turn, how to improve things. But what did you make of it?
Well, I thought the report was typical bureaucratese coming out of Washington. The report called for the big 3 C's: committees, commissions, and even approving the next head of the CDC at the Senate level. These are terrible ideas. The principal reason that California and Vermont did better was because those 2 states, not only do they have good leadership in public health, but they also have significant investment. When you look at Arizona and those southern states that you mentioned, those states invest next to nothing in public health. So although we've had 4 years of disinvestment by President Trump in our public health system that unfortunately was inherited by the next president, the fact of the matter is Arizona and the southern states have largely disinvested on their own in public health. So without the leadership, without the staff, and without adequate information systems, which we are way behind the rest of the world in terms of our COVID information systems, you know, it's not surprising. And it's unfortunate the GAO didn't go to the heart of the issue and called for remedies that are more or less the standard off-the-shelf remedies.
Will Humble, what do you make of what Gary just told us, that the problem actually goes back a long way? It has to do with planning, with infrastructure. I mean, there was a plan to counter a pandemic, which I think was put together by the George W. Bush administration, but it wasn't acted upon.
Yeah, no, I agree with 100% of what he just said. I mean, that was all really spot on. The poor performance, you see this incredible difference in the U.S., where certain states did really, really well and others did extremely poorly. And the same states that have poor leadership, who have governors that made bad decisions that were not evidence-based, are the very same states that have not been investing in public health infrastructure and in staff. And so those are 2 key pieces that work against the very states that performed the worst. And it's not a mistake. It's not, as our governor would say, bad luck. It has nothing to do with luck. It has everything to do with investment in infrastructure, having adequate good, well-trained staff, good resources, and then governors that care about the people that live in their states and about evidence and use data to drive their decision making. And you could look across the U.S. and you see this incredible range of performance. And it didn't have to be this way, but that's how it is.
Joseph Williams, you know, when the pandemic first swept across the United States, remember the challenges that everyone faced: tracking, tracing, testing, shortage of PPE. We remember healthcare workers having to use plastic garbage bags to protect themselves. But there is something else, and that's politics. And I was wondering, to what extent did politics make the situation a lot worse? I mean, this was a health crisis that was politicized by the Trump administration right from the beginning. It was a partisan ideological battle that emerged with people talking about their personal rights. So to what extent did politics worsen the situation?
Well, I mean, we're talking about it in the past tense, but I would argue that it's still ongoing, that it is a divisive issue. I mean, if we look back at the previous pandemics and the previous public health issues that we've had, there was no division between it. There was no states that were red or blue that were looking to fight the Ebola crisis, for example, in a certain way. When the flu pandemic of the early last century, the 1918, 1920s, people were very much united in trying to fight the virus and in trying to make sure that the country as a whole was doing better. You didn't have governors who were going against science. You didn't have governors who were trying to buck a president who insisted that the virus was non-existent and was not a threat widespread. So, and even once the president himself, former President Trump, got the virus, even that was politicized, and that he refused to acknowledge, A, that he had it, B, that he was going to use a vaccine and that was using experimental treatments to get it. And during daily briefings, there was misleading information about the extent of the president's health when he himself was a victim of the very thing that the nation was trying to fight. So the divisiveness of politics goes back. President Trump wasn't the first divisive president. He wasn't the first one to capitalize on that sort of division, but he basically brought it to a focal point, and it became, I hate to use the cliche, but it became almost a perfect storm of a divisive leader who was ignoring a crisis and was being cheered on by people, fellow travelers in his party, who saw political advantage to be gained by not acknowledging the science and not acknowledging how bad a threat this was.
Eric Muller, great to have you with us. As Joseph Williams rightly pointed out, this pandemic is still very heavily politicized. Now, there are Republicans in the United States Congress who are demanding that President Biden end the designation of COVID-19 as a public health emergency. That designation is set to end in about 60 days. Would that be premature if that designation ended?
Well, certainly what I think you see with this pandemic is that politicians who try to call the timetable end up ruining the day that they did. Ultimately, what you saw when President Biden came in was he said it will all be back to normal by the 4th of July, and it wasn't. And we've seen declarations even from President Trump at the very beginning that this will magically disappear and go away. And so I think until we have a clear sense that we are out of the woods on this pandemic, it would be premature to end the declaration. Are people sick and tired of the pandemic restrictions? Yes, they are. But ultimately, the fact that they are not willing to persist and carry on suggests a bigger failure of leadership that started with President Trump when he chose to politicize this process, to politicize mask wearing, to promote certain types of alternative treatments that had no basis in scientific fact. And so the pandemic has become very bad in the United States, and it remains very bad. It ebbs and flows indeed, but ultimately I think the country has no choice now but to stay the course. And the last thing you want to do is end restrictions because politicians think it's politically advantageous to do so. None of them are epidemiologists, so let's listen to the scientists.
Eric, just one more point on this designation. So COVID-19 is designated a public health emergency. If that designation is dropped, how does that change the way in which healthcare professionals handle the pandemic?
Well, certainly there are a variety of of ways that it can be both talked about in public policy in terms of how it's communicated, and also declarations of emergency give the federal government power to do certain things that it otherwise wouldn't be able to do. But ultimately, if you declare the pandemic over, say the emergency is over, and then you get another 50 or 100,000 people die, it looks ultimately like the federal government has abandoned the people who have the virus. What one needs to worry about, as we've seen with Delta and Omicron, is the variants. There are a lot of parts of the world where people are not vaccinated, and we've seen variants well up and spread very, very quickly into the United States and beyond. And so ending the declaration would say that the federal government is not interested in this anymore. And of course, then the healthcare workers, who will ultimately have to pay the cost of dealing with this, would be left with a situation where they are not being supported and in fact may feel abandoned by the government. So it is in fact a terrible idea to declare this over. One can certainly say that things are moving in the right direction, but the last thing you want to do is to take your foot off of the gas and any of the support that can be generated from the U.S. federal government infrastructure that emanates from declarations of emergency.
Will Humble, I want to move now on to vaccinations, and there's a pretty big debate going on in the country right now about vaccinating very young children. These are children 5 years and younger. There are trials that are underway right now, and the focus is on whether young children 5 and under would require a third dose. There was one comment made by Dr. Anthony Fauci, who's the country's leading expert on infectious diseases. He said it's his view that children that young would need that third dose. Where are we now, and will vaccinations how will vaccinations for the very young change the trajectory of the virus?
Well, yeah, so that's an interesting point. And as you mentioned, we're in the middle of, well, towards the late end of the clinical trials for those kids that are under 5 years old. And my attitude is, hey, let's look at the evidence and the data. I do trust the system that we have in the U.S. for determining what's safe and effective. I trust the FDA's process for reviewing the data that comes out of the clinical trials, and the CDC has a process about recommending those vaccinations through the Advisory Committee for Immunization Practices. So my advice is to follow the path that we have in place that's worked well for many years, with the collaboration between the FDA and CDC, and make sure that politics stay out of the decision making when it comes to the safety and effectiveness of vaccines and recommending them for certain populations. The second part of your question is had to do with what is that going to do in terms of the trajectory of the pandemic. And to be honest, I don't think that it would have that big of an impact. And here's what makes me think that the immunization rates are becoming less important over time in the U.S. Remember that the vaccines had decent coverage, poor coverage here in Arizona, but good coverage in many other states. And then we got the Omicron variant that came around at the end of November, which really infected enormous numbers of persons in the U.S. And quite honestly, that virus was finding all of those persons who were unwilling to get vaccinated. The kids were unable to get vaccinated, the younger kids. But the older persons in their 20s and 30s who did not want to get vaccinated or unwilling to do that, Omicron found them. And they built natural immunity when they recovered, the ones that did recover, through antibodies and T cells to the Omicron variant. And so I think in large part, the infections that have happened over the last 6 to 8 weeks in the U.S. have brought the effective vaccination rate much higher than it used to be, simply because what I call them is troublemakers, the persons who would not get vaccinated, ended up getting infected by and large.
Gary Richwald, on that question of vaccines for very young children, the Federal Drug Administration was supposed to meet with officials from the pharmaceutical company Pfizer today, Tuesday, but that meeting has been put off for 2 months. And given that young children we've seen that they're very vulnerable to the virus, I mean, can the country afford that kind of delay?
Well, I don't think there's really a choice. I think the leadership was not strong at the beginning. You know, most of our important vaccines, I consider hepatitis, HPV, meningococcal. These are the more recent vaccines, you might say. They all depend on injections at a couple of shots at the beginning in the first few months, and then some number of months later, often 6 months later, an additional shot to maintain that long immunity. To me, I don't know what they were thinking, that Pfizer was thinking that they would be able to get away with 2 shots 3 weeks apart with a very small dose of the vaccine, a 1/10 of the adult dose. So I think that this was a bit of a miscalculation, and viruses are a guessing game at times, so I'm not holding them responsible. But I just want to say one other thing, because children are just part of all of us in terms of our protections. And there's a train wreck about to happen. After 5 or 6 months, we are seeing waning immunity levels. And many people, I'm sure a lot of people listening to this program, are either getting up to 5 or 6 months after their primary series or after their boosted series. So I'd say a big part of what happened with Omicron, in addition to the fact that it's enormously more contagious, is the fact that people's immunity was waning. And there was an enormous number of breakthrough infections, and that is people exposed to this virus because the vaccine is not quite as good against Omicron as it was against Delta and some of the earlier versions. But we really, I just want to say again, if we take the foot off the pedal now, as we did in the spring and summer of 2020, and again, stupidly, in the spring and summer of 2021, we will give this virus the opportunity in the spring and summer of 2022 to replicate, to make worse variants. If we don't tighten up our testing systems, our delivery systems, if we don't start creating some trust in government and public health. I just want to repeat, the public health department does not have a police department associated with it. We depend on trust. We depend on people believing in the common good in order to succeed in beating down this pandemic. And 2 months from now, having the Congress say this isn't a problem couldn't be described better as sheer idiocy and something that will further undermine our public health response just by affecting trust in government and trust in science. So we better not do that. If not, I'm sure we're all going to be back many more times to talk about the worst variants that end up showing up on the scene.
Joseph Williams, of course, there is a big debate among parents on mask mandates and on vaccinations as well. This is what the vaccine chief at the FDA, Dr. Peter Marks, this is what he had to say. Let's listen.
For the next few months, while these additional data are gathered, parents will have to rely on what they've come to do well, which is they're using masking procedures and they're making sure that they're vaccinated and taking those types of precautions with their youngest children.
So, Joseph, listening to Dr. Peter Marks there, I mean, is that going to assure parents?
It's hard to say that it will. A really close friend of mine is a parent of a child who's going on 1 year. He's really nervous because the place where he lives in Washington, D.C. is about to remove mask mandates for indoor dining. And even though that's not a school, who knows whether a teacher might go out to dinner and catch the virus and bring it to the classroom? Who knows whether or not the daycare provider that he's leaving his son with would happen to catch the virus outdoors because the mask mandates have been restricted. And listen, we talked politics a few minutes ago. This is exactly where the rubber meets the road in terms of politicization of the virus and of public health protocols that will help bring it down. The neighboring state, Virginia, Glenn Youngkin, Governor Glenn Youngkin, first day on the job, signed a declaration that parents no longer have to force their children to wear a mask, that masking in schools is optional. And furthermore, to add a little more gas to that particular fire, he recommended that schools, or not he recommended, he ordered an executive order maintaining that schools will stay open regardless of the level of infections. So mask mandates are just a crazy quilt all over the place in terms of schools. Some school districts, you have teachers who are so concerned they're going out on strike. Other districts, you have parents so concerned they're flooding school board meetings and disrupting the procedure of regular order because they want to make sure their children are not required to wear masks. So the science, even the science is kind of all over the place in that you have some studies that indicate children have learning loss and more anxiety when they are learning from a teacher who is wearing a mask than they don't if they have a teacher whose face is fully uncovered. So again, the virus will have the last word, and it was a sobering assessment by the doctor who previously talked about if we let our foot off the gas. I fear that that particular horse is already out of the barn.
Yeah. Eric Miller, on mask mandates, as Judge Williams just said, it's a bit like a quilt. I mean, there's a patchwork response across the country from state to state. Many states have lifted the indoor mask mandate, but at the same time, they're not doing the same thing for schools. I mean, does that make sense, lifting the mandate for adults while requiring it for children?
Well, this debate about children is a very sensitive one. It's obviously very emotional for a lot of people. My daughter goes to a school where they require masks, and it becomes part of the daily uniform that children wear. A lot of this comes down to expectations that are set by adults and how parents choose to proceed with it. I mean, I think it's incontrovertible that masks work, given what we know about how COVID is transmitted and how one can protect oneself. Masks do work. And well, we may not like to see teachers in masks, or we may not want to have to wear masks ourselves. We are in a pandemic, whether we like it or not, and we have to do this. And part of the process is talking to children about how to do this. And my experience, very direct with my own child, is that if you talk to them and tell them you need to do this, children are much more flexible than they're given credit for oftentimes. And I think a lot of the discussion around should we remove masks for schools is part of the bigger process of, quote unquote, I want to get back to normal. Well, many people do want to get back to normal, but the reality is we have to get through this pandemic, and the way to get through this pandemic is to stop the transmissions.
Will Humble, very quickly, I've only got about 30 seconds. I want to get back to something that Gary mentioned earlier on, and that is the fact that the effectiveness of vaccines, of booster shots as well, will be waning. I mean, are we going to get to a point where we're going to need a fourth shot?
Well, I think that remains to be seen. There's two pieces to the puzzle. I know this is short. There is waning immunity from antibodies, but thankfully, the T-cell immunity, that cell-mediated immunity, is holding up much better than the antibody immunity, and that gives me some comfort that things may eventually get better at some point in 2022.
Okay, and that's where we have to leave it. Thanks to all of you for being with us. I'm Anand Naidu in Washington, D.C. Thanks for watching.